Exactly what happened.
I just was up the road from my mum and she had a bad headache.
Okay.
So I've come down and now she's unconscious but breathing really funny and the eyes rolled back in her head.
At the Melbourne Emergency Communications Centre, a terrified daughter is on the line. Her 64-year-old mother, Vicky, has suddenly collapsed.
Now, is she awake?
No.
Is she breathing?
Well, she's making funny noises, like gurgling.
Gurgling. All right, we're going to get her some help, okay? So stay on the line. I'll tell you exactly what to do next.
Flight paramedic Ray and an air ambulance team are heading to the critically ill patient 70 kilometres away.
Zero off takeoff. It's good from left and good in the back.
A local MICA team from the Geelong area are also on the way.
I am clear right, turning right. Roger.
From all reports, this lady is normally well, but today has developed these shocking headaches. We're suspicious immediately this patient probably has had a stroke. A bad stroke will kill you, and the mortality rate is quite high for severe strokes.
The road paramedics are now only minutes away from the patient.
All right, she's unconscious and making those funny noises, so we're going to start CPR, okay?
Emergency services are trying to help Vicky's daughter, Nicole.
I just don't know how I'm going to get her off. I didn't have a chair.
So if she's on the chair there, just grab her by the ankles and slide her off the chair onto the floor. Don't worry about the fall. We need to help her now. Let me know when she's on her back, okay?
Oh, God. Sorry, Mummy.
No, I'm just going Corroy Creek Road to Laverton.
Corroy. That's like one of my favourite street names.
Corroy?
Corroy Creek Road.
In Melbourne's west, best mates Risky and Nicola are between cases, but finding ways to amuse themselves.
Try saying that 5 times fast.
Corroy Creek Road, Corroy Creek Road, Corroy Creek. No, I'm not even.
You don't even make 3.
Nah. When you spend a lot of time with someone in the ambulance, you find yourself talking about some strange things sometimes. Can you do it?
Corroy Creek Road, Corroy Creek Road, Corroy Creek Road, Corroy Creek Road, Corroy Creek Road.
You look really happy with yourself.
Corroy Creek Road. Maybe you should add that into your stroke assessment. Get them to say Corroy Creek Road 5 times.
Life's fun on the road with Nicola. She takes the mickey out of me a fair bit, but that's what I love about her. You need those kind of people in your life.
But the banter's over with a call out to an elderly patient.
So we're on our way to an 89-year-old female complaining of a headache. This could be as simple as just your standard headache, but it could be something really serious like a cerebral hemorrhage or a massive stroke. Hello, ambulance. How are ya? Who are we here to see?
Maria.
Maria. Hi, Maria. My name's Nicola. This is Michelle here. So what's happening today?
I get shivery.
Get shivery?
Yeah.
Yep.
And headache.
Headache?
All my bones, all my belly.
Yep.
Cheek.
Yep.
Great-grandmother Maria lives with her daughter and son. They've never seen their stoic mum in this much pain.
Very unusual for my mum. She's still a tough old girl, and if she's laying in bed and she can't get up, there's something wrong. Totally out of character for mum.
Emergency services. Tell me exactly what happened.
There's been a big car accident in front of us.
How many cars involved?
2.
First job of the day for flight paramedic Matt is a high-impact car collision at Phillip Island, 80 k's southeast of Melbourne.
How many people are hurt?
Oh, there's quite a few. There's kids.
Is anyone trapped?
Yes.
So just stay on the line, I'll tell you exactly what to do next.
It's 2 patients from what we can gather at this stage, a female in her 50s and a young child of 11 years of age. From reports, both of them sound as though they've got chest injuries.
That's where it is, right there.
Approaching the scene, you can see it's a large scene. There's multiple cars already on site, lots of emergency vehicles. And my immediate thoughts are about getting around and assessing the patients that are at scene and working out who is the sickest.
Taylor's clear of the power lines at the back on the left. Roger, come down just fluid in his head on the left. 3, 2 and 1. Clear on left.
Matt's taken immediately to witness the crash scene. A 56-year-old woman and her 2 granddaughters have been freed from the wreckage of the white sedan. It's miraculous that no one has been killed in this horror smash.
No brakes on this lady's part, so this is the cabin intrusion.
Yeah.
So airbag hasn't deployed.
Yep.
So we're querying at lung contusion.
Sure. When I actually look at the accident, I can see there's been significant force and major intrusion to the side of the vehicle. Immediately I think about where people sit as the accident occurs, and I think about the forces that are transmitted through those vehicles and how they will affect the actual patient. So I'm very concerned that these patients are going to have significant injuries.
All right, now listen carefully and I'll tell you how to do resuscitation. Place the heel of your hand on the breastbone in the centre of the chest, right between the nipples.
Back at the Emergency Communication Centre, a call taker is giving CPR instructions to a distraught daughter. Nicole's 64-year-old mother Vicky appears to have had a devastating stroke.
So I want you to pump the chest hard and fast, at least twice per second and 5 centimetres deep. We're going to let the chest go all the way up between pumps, and we're going to do it 600 times or until help can take over.
20 minutes, Ray? Sure.
Flight paramedic Ray and the air ambulance team are on their way to Geelong to airlift the critically ill Vicky back to the city.
The mechanics of CPR is quite brutal. You are pressing on chest really hard, really fast. You can break ribs. And doing that on someone you love, waiting for the ambulance to arrive, must be the most traumatic thing in the world.
So I want you to count out loud so I can count with you. I want you to start pumping the chest. 1, 2, 3, 4. 1, 2, 3, 4. All right, keep going until help comes. 1, 2, 3, 4.
With the air ambulance still en route, the MICA road team has now reached Vicky's house.
Strokes are one of the most time-critical events we can have. Like heart attacks, time is tissue. In this particular case, time are brain cells.
Within a few minutes, the intensive care specialists have put Vicky into an induced coma. They're now heading to the local football oval to meet up with the helicopter.
They haven't sort of indicated where the good vehicle access is, although what's this off in the forward right? Spare gate.
Personally, I find the thought of a stroke probably the most confronting thing that would happen to me.
Okay, clear doors, guys. Yeah, left looks fine.
Something that takes away your brain and your personality and your ability to think, your ability to act and to interact with people. To me, that's by far the most devastating thing that could happen to you.
Basic story today, a severe headache, like she's been hit to the back of the head with a baseball bat. Then she's collapsed to the ground, agonal breathing, and daughter started CPR for a brief period of time. So definitely something neurological going, there's no doubt about that. So we've elected to RSI her under the non-traumatic brain injury guidelines.
Yep, nice job. You've got nothing to do. Let's put her on a ventilator and go.
To save Vicky's life, Ray urgently needs to get the 64-year-old to a neurosurgeon at the Royal Melbourne Hospital.
So we're all happy with this unusual plan of putting her on the board and popping her over the top?
But there's a problem. The gate at the oval is locked.
Yeah, so feet first.
And they'll have to lift Vicky over onto the helicopter stretcher.
Okay, we're happy. We're just going to get a few people over this side of the fence.
The action of moving someone across the gate basically exposes us to losing the intubation tube, losing all that plumbing, so our IVs, it could potentially dislodge equipment, which is essential for us to monitor her very health.
Let's just stop there for a second. Just got one seatbelt to do.
So you've got a tube going down into her lungs and we're controlling her breathing. Basically, we're breathing for her. If we lose that tube, we lose that ability to breathe for her and she could potentially die.
Just need one more person up that end.
Do you have pain?
My head.
So you still have the headache now?
Meanwhile, Nicola and Risky are still trying to work out if their patient, great-grandmother Maria, has also suffered a stroke. Son George is alarmed at his mother's symptoms.
The big thing was that she had a severe headache, and that was concerning because she doesn't really suffer from headaches.
Feel hot, feel cold.
Feel hot, feel cold?
And all the heads are everywhere.
And you feel tired?
Yeah.
After Maria tells me a little bit about what's been going on, the first things I need to tick off are check her blood pressure, her heart rate, her temperature, and just see if we can get a better picture of exactly what's happening here.
Yeah, 38.3.
You've got a temperature. So how about when you go to the toilet for wee? Has that been normal?
Oh, I have plenty of wheeze.
Lots of wheeze?
Yeah.
More than normal or?
More.
Okay. I was thinking maybe a urine infection, but can't be certain.
Urinary tract infections, or UTIs, are common in the elderly, but if they're not treated, they can cause permanent kidney damage and even fatal septic shock.
I never have in my life.
Never?
Never.
Maybe this
First
is the
time for
first
everything,
time.
isn't there?
Despite feeling so unwell, the brave Maria is more worried that her English isn't good enough.
In so many years in Australia, we should speak better.
Oh, your English is good.
I have English friends.
Okay.
And they said to me, you want to learn English?
Yeah.
And teach me.
I only know one word in Greek.
What?
Ponos or ponoi?
Ponas.
Ponas, yeah.
Ponas.
Pain.
Yes.
Yep. We'll get you sitting on the edge of the bed. I want to see how you go sitting up here. Give you a hand. Despite the fact that Maria has a headache, I'm confident that she's not having a stroke because she's able to talk normally, her face isn't droopy, she can move all her limbs. But she could have a urinary tract infection and that could still be serious for someone her age. All right, let's get you onto the bed.
If you don't think you can do it, just let us know.
We need to get Maria into the ambulance and get her off to hospital as soon as we can to get further tests.
If you feel dizzy, you let me know, okay?
Back in Phillip Island, flight paramedic Matt's about to get his first look at the victims of an horrific road accident.
I'll just jump in and have a quick chat. Hi there, how you going?
In the white sedan was a grandma and her two granddaughters. One of the girls, Zara, is already on her way to hospital. Matt's about to assess the other granddaughter.
What was your name?
Sophie.
Sophie, my name's Matt. Can I just get you to relax your teddy just for a little bit, please? Now, how old are you?
11.
11. My daughter's 11 as well.
Assessing Sophie, it's hard not to feel a connection and feel some emotion. You know, I can't help but look at her lying on the bed and, you know, wonder if that was my daughter, how would I be feeling and how would I be reacting?
So this is going to be really quick. There's no pain, but it just feels cold with what I'm about to do, okay? Take a big breath for me.
Matt's using ultrasound to check for any internal injuries.
And another big breath for me. I'm happy with that. I'll let you take Sophie off to hospital.
You want to hold on to this bloke again?
We'll leave you to it.
So Sophie looks as though she's in the clear, which is fantastic. But my main concern now is her grandmother, who appears to have sustained the full force of the impact from the accident.
Hello, how you going? How you going? All right. What's your name?
Anna.
Anna. My name's Matt.
Hi, Matt.
Okay, I'm going to take you to hospital, all right?
Thank you.
Have you got a lot of pain at the moment?
When I breathe in on the right back side.
Right on the back?
At the back.
Okay, I'll just do the ultrasound. So, Anna, I'm just going to squeeze a little bit of gel on your chest. Feels a little bit cold. Righto. Can we just get some more fentanyl drawn up, please?
So I look at Anna and she's got a large amount of pain. So I'm thinking, has she injured anything in her chest? Has she got some broken ribs? Has she collapsed a lung? Has she damaged her pelvis? Has she got damage to her intestinal organs?
Anna, big breath for me.
Anna is in serious trouble here.
Just need two lifters, one on the airway.
Back in Geelong, flight paramedic Ray needs to emergency airlift his critically ill stroke patient 70 kilometres back to Melbourne.
Okay, stop there.
But a locked gate at the helicopter landing site is taking up valuable time, with 64-year-old Vicky just clinging to life.
It's a really delicate operation. It's got to be coordinated well and it's got to be slow and smooth. We're controlling her breathing, and if we lose that tube, basically, she could die.
Okay. Are you good?
I'm good. So we get Vicky onto our stretcher. That move has worked well. All right. And now it's time to get out of there and get back to Melbourne as quick as we can.
And we'll send it back in garage. The obstacles, light poles off to the right, goalposts there.
As the helicopter takes off, Vicky's husband Andrew and daughter Nicole are now making the 1 hour drive to the Royal Melbourne Hospital.
So one of the limitations of the helicopter is that very few times can we take a relative. And we try to instruct relatives all the time, don't go burning down the road. I don't want to have to pick up someone else in the family. They're hoping we can do our job. They're hoping we can keep Vicky alive. And they're hoping that when they get to hospital, they've got a loved one to see.
Airborne for the Royal Melbourne. She's a 64-year-old lady. She's now intubated, sedated, paralysed, ventilated.
This morning, all seemed completely normal. Andrew's wife of more than 30 years was at home while he was helping out at the local Salvation Army. Then came the news. Vicky had collapsed.
I saw the ambulances and paramedic cars and fire trucks, and I didn't know what to think. And then I rushed in the house and saw my wife we could lose her at any time, you know. It's very confronting and very emotional for the whole family. We're very close and very loving. She's just a decent woman.
India, 3 miles south of Lebanon, Bob Tower, 1,500. Ready back for the Royal Melbourne Hospital, not above 1,500, request clearance.
I look at Vicky as we're travelling into Melbourne, and I really am anxious as to what her prognosis is. Whether it's a bleed or whether it's a blockage in her head, something is significant enough to make her unconscious. The prognosis for that is generally poor. For Vicky, this is going to profoundly change her life, if she survives at all.
Do you want some help, Maria?
Let me do how I come every day.
Okay. Good job.
Across town, Risky and Nicola suspect great-grandmother Maria may have a nasty urinary tract infection.
Now we just need your bottom up nice and high up here, okay?
Daughter Helen and son George have never seen their brave mum so unwell.
You're fine, you're fine, you're fine.
This could be quite serious for Maria, given her age. Elderly patients don't tend to deal with infections as well as younger people.
And let's head off to Footscray. Maria, do you know what day of the week it is today?
No.
Good. It's quite common for a urinary tract infection in the elderly to cause them to have some confusion. So now that we're in the ambulance, I want to check Maria's mental state. And I do this by asking some simple questions to make sure she's aware of what's going on. Do you know what month it is?
February.
Good.
Maria's been able to answer all the basic questions, so Nicola's decided she might be ready for their brand new test.
Just wondering if you can say Cororoit Creek Road 5 times in a row, really fast.
Cororoit Creek, Cororoit Creek. I'm not very good.
Oh, you were doing well. Pretty well. You did better than Nicola.
Yeah, you did better than I did. It's not something we normally ask everyone. She's nailed it. So now that we've got Maria to hospital, we'll take her inside where they can run some tests to make sure that this is just a urinary tract infection. Then they can manage it from there, and hopefully she's going to be okay.
Thank you. Thank you
You're welcome.
very much.
No worries.
And I wish you, God, to have you strong and help the people.
Thank you. It's been a pleasure. You're a nice patient.
The grateful Maria will now have blood tests to confirm if she needs to be treated for a dangerous infection.
Almost there.
And a big breath for me.
At Phillip Island, flight paramedic Matt is concerned that 56-year-old Anna may have suffered life-threatening internal injuries in a shocking car crash. Anna was driving her 2 granddaughters to school.
Where are the girls?
They've gone to Melbourne Hospital.
Yeah, they're going to go to Monash with the young girls.
So if I had been in a car accident and I had injured my own children and then been separated from them, I would be emotionally distraught, worrying about what had happened to them. What type of injuries have they got? You know, the emotions and the concerns that Anna would be feeling at this point would be very overwhelming.
So the littlies are okay, all right? The kids are fine.
Sorry, I know that hurts a little bit there.
When the airbag didn't inflate, Anna took the full force of the impact. Matt's checking her for a potentially fatal collapsed lung.
Righto. Both lungs are inflated there, but I think you've got a broken rib or two there on the backside on the right.
By ultrasounding Anna's chest, I can see that her lungs are inflated, but there's a high suspicion that she has got bruising on her lung tissue. And so it's really important that we transport her to a trauma centre as early as possible.
Right, Anna, I'm going to give you some more medicine now, which is going to make you feel a little bit sleepy, but I want to make you comfortable because we're about to move you from one bed to another.
I still don't know at this stage whether Anna has sustained injuries to her spine, whether she's broken her pelvis or anything, so at the moment I need to treat her as gently as possible.
So Anna, we'll get you alongside another bed and slide you across onto it. Just relax back as we do that, nice and slow, no rush. So just stop there for the moment, Tony. If you can roll Anna so we can get this underneath her as we turn.
During the transfer to the chopper stretcher, Matt puts a precautionary pelvis brace on Anna.
3, 2, 1, go.
Sorry, love, Anna. Almost done.
Okay, no worries. Bit of discomfort in your hips here as I pull this tight.
Okay.
All right. So on your call there, Tony.
Okay, 3, 2, 1, go. Lovely.
Right to go, no brakes on. All right,
With the grandmother now safely on the chopper, it'll be a 30-minute journey to the Alfred Hospital.
The likelihood is that Anna's got multiple fractured ribs, potentially bruising on her lung, possibly internal injuries which we don't even know about yet. So it's really important that we take Anna to the appropriate trauma centre.
Anna, we're about to go into the Alfred Hospital. As we come in, it gets a little bit bumpy and a little bit shaky, okay? That's normal. You get a lot of vibration through the helicopter.
Anna has remained stable throughout transport, which is great, but we're still very concerned. She's not out of the woods at this point. She needs to go and be assessed and determine how severe her injuries are.
Emergency services.
Tell me exactly what happened. We've got a suspected spinal injury.
Okay, she was on the Aqua Thumb Park inflatable and she slipped off.
In Melbourne's southeast, a fun day out at a water park has turned into a nightmare. It has MICA single responder Al on high alert.
She fell into the water and she heard a crack in the middle of her back.
So the case we're going to now is a 20-year-old female. She may well actually have a severe neck injury.
So she's out of the water, just confirming? She is out of the water. She's lying on her spinal. Yep, okay. I've organised some help there for her now.
Since the accident, the girl's been unable to move. After more than 20 years on the job, Al's acutely aware that spinal injuries can lead to permanent paralysis.
No worries. The worst outcome is that you end up either a quad or a paraplegic. We don't want her to be in a wheelchair.
Little bright for you now, mate?
Yep.
It's a relaxed start of a new shift for paramedic veterans Cam and Doddsy.
There's a nudist beach down here. We might get a job down there.
Oh.
So if we go to a nudist beach, do you reckon we have to conform with policy?
I'd like to think so. That's an interesting question.
You can still wear your safety vest.
Mine's very short.
What about your vest?
Yeah. Dodsy's a good mate of mine. I love working with him, and it's always a laugh. And in between jobs, you know, you really need to wind down a little bit, so... But just the thought of seeing Dodsy nude on the beach, maybe in his ambulance vest, it's probably something that nobody should say.
Thank you very much. Try the chicken.
But an urgent call changes the mood in the ambulance.
MICA 30 on code 1, it seems like this car out or vehicle is on its route.
MICA 30 received, thanks.
The accident is 80 k's from the city on the Mornington Peninsula.
So, car accident, Query rollover.
Yeah.
So it's on this road, so straight ahead.
Thanks, mate.
More details are now coming in to emergency services.
How many vehicles are involved?
One, and the car just did a flip and it's ended up on its roof. There's got to be people hurt in this. There's got to be.
Is there any fire or smoke?
There is smoke coming. Not dust, smoke. I hope everyone's all right, but I don't think they are.
Clear left, thank you.
Roll over to me, I think trauma. I think, people have been thrown around in the car, possibly hit their heads, a lot of damage to the car and a lot of potential for injury to people.
There it is on the right-hand side.
So just arriving, looks like a single car, still on its roof.
There's no one in it by the looks of it.
So when we first arrive, it's chaotic. There's a lot of bystanders. Often the hardest thing is working out who's involved.
Hello, I'm Cam. What's your name? Jenny. Okay.
The two occupants of the car have already managed to get themselves and their pet dog out of the wreckage. But things are tense.
What's your name, mate?
Craig.
Ray?
Ray.
Craig.
Yeah.
Good on you.
I was driving.
Yeah, okay. Hey, Craig, could you pop the smoke out for me, mate?
No.
All right.
When I first meet Craig, I'm a little bit cautious just because I've been told that he is impaired by alcohol.
Thanks, mate.
I just had a car rollover, mate.
I understand. And this one, is this one all right? Seems okay?
I know, it's not
Craig's probably really concerned not only about his partner but about his dog. It's not my job to judge him, it's my job to treat them medically.
Hey, Craig, you've got cuts and grazes all over you. Is that just from when you crawled out?
through the barbed wire fence.
Yeah, I'm going to look after her, but I just had to check on you both as well.
So just because Jenny and Craig have got themselves out of the car doesn't mean that they haven't got injuries. So they could have internal bleeding, they could have even broken bones, but either the alcohol or the adrenaline that's surging through their bodies is masking a lot of that at the moment. So until we have a good look at them, we don't know what's going on.
Yeah, watch his back, watch your back, watch your back, watch your back, watch your back.
What happened? Do you remember what happened?
Yeah, I slipped and kind of like bent in half and my back made a big cracking.
Okay.
Back at the water park, intensive care paramedic Al is about to assess 20-year-old Alicia for signs of a broken neck or back.
Where did you bend in half? From sort of near your neck or your chest? Or so if I was to point...
Yeah, right. Sort of behind.
Just pretty much umbilical region. You went like that. When Alicia told me that she heard a little snap, certainly that heightens your suspicion that there's potentially injury to her spine. Got any pain anywhere?
Just where it's cracked.
Al's now searching for any telltale signs of a spinal injury. Sensations like pins and needles, numbness, or no feeling at all.
Lift your arms up and grab my fingers. Can you do that? Can you squeeze? Squeeze really, really hard as you can. Is that aggravating any pain anywhere? Aggravating your back, okay.
Alicia's boyfriend Sean was by her side as their fun day turned into disaster.
She bent backwards and then fell into the water. We were all laughing at the time, and then she bobbed back up and she was in tears, and then I guess all of our hearts just sunk, really. We didn't know what happened.
Alicia, can you just push against my hand? Can you do that? Don't do it if it aggravates it. Okay, that's all right.
Alicia wasn't in a good state. She was very upset. She said her legs were a bit numb, so it didn't sound great.
Just tell me if you feel any difference here at all on your face. Nothing? No? Okay, that's good. After doing the assessment with Alicia, I feel as if things are going to be good for her and okay for her, but I can't give the all clear. The issue for her is that she needs further specialist examination to ensure that she hasn't done permanent damage.
you've got some pain in the back. Did you hit your head? No? No. So you didn't lose consciousness?
On the Mornington Peninsula, intensive care paramedic Cam is also starting to worry that one of his patients has suffered a debilitating back injury.
Is that sore down there? Okay, and it goes across here. Okay.
Jenny, her husband Craig, and their pet dog Bob were in the car when it flipped and landed on its roof.
Did anything hit you in the car?
Jenny herself initially seemed relatively well, but the more I speak to her, the more she starts complaining of this back pain.
Hey, Jenny, whereabouts is the pain? I'm going to work my way all the way down, okay?
Anything could come of it. It could be a soft tissue injury, she might have been hit by something, she might have twinged a nerve, but it could be a spinal fracture or something that's really going to be time sensitive, and she might need a trauma centre.
If I bring the bed over to here, are you able, if I assist you, to just pop onto the bed? Is that okay?
I don't know if I want to.
Okay. What about if I give you something for the pain? Listen to me for a moment, okay? I'm going to look after you. Okay, I'm going to do...
I don't want to end up with back pain for the rest of my life.
No. Hey, Todsy. Can I have pen train, please? And then the bed all the way in here. She's really worried about her back.
So in the state that Jenny's in at the moment, she's single focused on having this back injury. Regardless of the discussion we have, regardless of the advice we try to give her, she doesn't want to move. We have to be persistent because she could have injuries that could be quite catastrophic.
Listen, I'm going to give you some medicine to breathe on and then we'll pop on the bed.
No, that's not.
Just a couple of bumps, love.
20-year-old Alicia's heading to hospital after a potentially devastating fall at a water park.
You all right? Okay.
Alicia's boyfriend Sean is doing his best to keep her spirits up.
How long have you been going out for?
Over 6 years now.
6 years?
Yeah.
Jeez, you're almost married. It was great for Alicia that she had Sean with her. Patients are vulnerable. They're in a situation that they never would have imagined they would be in. So it makes a big, big difference. Nearly there, okay? Okay. Now, are you worrying about what's going on? Are you scared about things? Good, that's the best way to be.
If a permanent spine injury was to happen, Alicia wouldn't be able to do her horse riding, wouldn't be able to ride motorbikes, you know. It'd be a very different lifestyle for us both.
The ambulance has now arrived at Dandenong Hospital. Sean will soon find out how much damage has been done to Alicia's spine.
You right, man? Okay, yep. Fingers crossed that she's actually going to be okay and she'll eventually walk out of that hospital as opposed to potentially being in a wheelchair with long-term disability. That'd be a devastating news certainly for Alicia and everyone around her.
Okay, so what we'll do is we will assist you onto a bed. We'll give you something for the pain.
Intensive care paramedic Cam is doing everything he can to convince Jenny that she needs to go to hospital after a traumatic car accident.
Hey, pop us your wrist, hon. I just want to feel your pulse, okay?
She's in intense pain after crawling from the wreckage of the car.
I want you to hold this for me and pop this bit in your mouth and little breaths. I need that medicine to go back into your lungs, okay? Slow down, nice little breaths, okay?
Cam's hoping that once the pain relief kicks in, Jenny will finally agree to be put onto a stretcher.
I'm going to have to get you to move a little bit, okay? Can you feel your feet? Yeah, okay.
So now I've given Jenny some pain relief. She's a little bit more relaxed and she's compliant. So finally we can start to move Jenny onto the bed and get her into the back of the ambulance.
Just really gentle, mate.
You come, Jen.
That's the way.
Just do it in stages if you need to.
That's the way.
Another paramedic crew will transport Jenny to hospital.
Sweetheart, no more shaking and no more nodding your head, and I'm going to put a collar on.
We put the neck brace on just as a precaution so she doesn't move her head anymore. And this is purely to prevent further injury later and bring everybody's attention to the fact that she hasn't been spinally cleared yet.
Oh, well done. Well done.
Nice work, lads.
With Jenny on her way to hospital, Cam is turning his attention to Craig, the other survivor of the car rollover.
Hey, Craig, we're looking after Jenny, mate, and I'm worried about her because with a rollover like this and trauma, you can have internal injuries that we can't see. I don't think that you can make a sound judgment at the moment with how impaired you are. I would like you to pop down to hospital just for a checkup, mate. You've been in a rollover, you've got cuts all over you, and you're impaired.
You gotta look after him, mate.
I want to have a good look at Craig. He's covered in cuts and grazes, and I don't know if it's from him just trying to get out of the car or if he's sustained some serious whacks and possibly internal injuries. But he's so preoccupied, concerned for the dog, and I understand that. It's probably a really good mate of his, but my focus at the moment is him.
You are no good to Bob if you're dead. With us, Craig, I'm sorry, mate, it's a hospital. These guys have said that they'll look after the dog.
You won't eat, you won't drink.
Good Samaritans have agreed to look after Bob while Craig and his partner Jenny go to hospital.
I think Bob will behave. Are you right with that?
Yeah.
Craig, he's hard to win over. That's the thing about being a paramedic. Sometimes you think that you're going to roll up to guts and gore and people hanging out of car wrecks, but in the end, you might just have to use your interpersonal skills to win people over, to get them on board with what's best for them.
Craig, this is Steph. She's gonna pop you down to Frankston to get you looked at, okay, mate?
Yeah, but the big problem is him.
You don't want to send him off with these people?
He won't go.
No. Is he a bit stubborn, is he?
No, he just doesn't like crazy.
Okay.
They look like nice people, though.
Let's try.
Try it.
Come on, Bob. Come on, Bob.
First, it took a while to get Jenny compliant. Then I've finally got Craig compliant, and just when we think we've had a win...
Hey.
Bob keeps stopping and looking at him.
Bob decides he doesn't want to go off with these other people. So we're back to square one.
Go on, Bob. Up you get.
But with an encouraging pat from Craig,
come on, Bob.
Bob gets moving.
Finally, Bob's decided to go with the Good Samaritans.
And there you go. Bob's in the back of the car.
But we've still got to be careful the way that we treat Craig, because he's just as likely to change his mind at any time.
Craig, let's go. Steph will take you over to this ambulance.
They've got a member going with you as well.
With Ryan, okay?
I've been to a lot of these accidents before. Cars rolled over, alcohol involved, and people die in those accidents. So Jenny, Craig and Bob have been very lucky.
How's the poor dog, mate?
Well, Bob's gone home with that nice couple that stopped and assisted.
Yeah.
You know, which is good for them. They don't have to do that.
Once
They're
again,
taking on the
best of
responsibility.
society, mate.
Mate, it just reiterates to me that there's some bloody good people left in the world.
Got any pain anywhere?
Just like where it's cracked.
When 20-year-old Alicia crashed onto her back at a water park, it was feared she damaged her spine.
Are you scared about things?
Come on, boy Jax.
But today, the future's looking bright for Alicia and her boyfriend Sean.
It was very scary when it happened. I was expecting the worst and it could have been anything. It was only once I'd had the x-rays and then I actually found out that it was just the strained ligaments, so it was best case scenario, I think.
Untangle yourself.
Come on.
Come on.
Bye.
For Anna, it's been 5 weeks since her horror car accident as she was driving her 2 granddaughters to school.
Where are the girls? They've gone to a Melbourne hospital.
Sophie and Zara were lucky and escaped with only minor injuries.
Hello, how are you?
Today, with their mum Rochelle, they're visiting Grandma in her rehab hospital.
Good to see you. Oh, how's my baby?
I had 2 broken ribs. I had 4 fractures in my pelvis. They said you won't be able to weight bear on your legs for 3 months. They just told me on Friday that I can actually hobble on this one, and actually I can't stand on this one for another 6 weeks, so we'll see how we go. All I remember is I looked and there was just this car right in my face. Sophie jumped out the car, the little one, was screaming, saying that she'd hurt her head a little bit. Afterwards, it dawned on me, and I was just, even now, I think, my God, that was a godsend that we came through okay. You feel all right, Sarah? I'm just so relieved that the girls were okay. It just shows you how life can be changed around just like that. It was a hard thing we went through, wasn't it? Yeah. Yeah, but it's all good now. It's getting better every day, isn't it?
So you still have the headache now?
Great-grandmother Maria had a terrible headache, and Risky and Nicola were worried she was suffering from a nasty urinary tract infection. But tests ruled out a UTI, and the 89-year-old was treated for dehydration and went home later that night.
Thank you.
You're welcome. It's been a pleasure. You're a nice patient.
Watch his back.
Jenny and Craig and their pooch Bob managed to escape their frightening car accident with only minor injuries.
Bob, shake. Paul, good boy. As soon as I knew I'd lost control of the car, I feared the worst. No one's going to survive. We're all going to be dead.
Craig had a couple of beers. It was the worst decision.
We could have killed other people.
In one way, we're lucky the car flipped and stayed on its roof. He could have swung back and taken out a family going out for a Sunday afternoon drive. And neither of us are the type of people that would be able to live with that.
Go, Bob, go. Go get it, Bob.
It was a miracle, absolute miracle. The next morning, I still had my best mate Craig, my best mate Bob, and that's pretty good.
Lovely walking. Lovely walking. How are we going to get you clean, hey?
As for Vicky, she was emergency airlifted and rushed in for major brain surgery after suffering a massive stroke. The 64-year-old remained in an induced coma for 3 weeks, close to death.
The doctors didn't really think she was going to make it. Mum's everything. She's like the strongest woman you'd ever meet.
All right, come on, Del.
Come on, Dad.
Just walk over there.
Yeah, I'm trying.
6 months later, Vicky is finally taking her first steps.
It's about time we got to do some exercises.
Oh, really? Okay.
All right, so you got to do the 1 steps at the back.
She's got a long battle to go.
2, 3.
We have lost her, a little bit of her. But hopefully we'll get it all back. If not, we'll be glad what we got.
7,
9,
8,
10.
9. Another 1, come on. 10. Now backwards.
Just got to be optimistic. You do find an inner strength.
Are my boobs out far enough?
Yeah.
I feel lucky to be alive. So I've still got a whole lot of living to do with my husband and my children and my 13 grandchildren, and no bloody stroke's going to take me.
Oh.
Here I am. Yeah, it's all good. All good.